Hi, my name is Poney Chiang of Neuromeridian Acupuncture from Toronto, Canada. What I would like to do today is to share a case study with you where I've used Dr. David Alimi's teaching to really make a big difference with a very interesting case of laryngeal atrophy. So the title of my presentation is Case of Laryngeal Atrophy, a Neurophysiological Approach to Auricular Acupuncture Therapy. Back in October 2018, a 65-year-old male patient presented in my clinic with very weak swallowing reflex that has been happening for 1.5 years. The onset of this condition was 6 months after having contracted pneumonia. At the time, that's when the difficulty of swallowing began. He would choke whenever he drinks water at regular speed, and now it has progressed to the stage where it would take him literally 10 seconds to swallow one small sip of water. And previously, when I have treated patients such as these, I would actually pre-measure a specific volume of water and time the patient to see how long it takes them to drink it. This way I could track improvement in the future. But it wasn't possible to do so with this patient because drinking one sip of water would actually take 10 seconds as he struggles to just slowly drink this. So because his swallowing peristalsis of the larynx is compromised, he eventually had to have a tracheotomy. And this was for safety reasons, so that should the food pass down to the wrong tube, then there was a way for them to quickly aspirate the food out so that he would not asphyxiate. He has been consulted by a neurologist who had ruled out ALS, and under video diagnostic imaging of the larynx, it was found that his larynx was indeed showing evidence of atrophy. He is on medication for cholesterol, hypertension, and because of this difficulty in eating and swallowing and drinking, it has led to, not surprisingly, depression and associated dysautonomic conditions such as insomnia. His tongue is thin and white, has a thin white coating, has a normal pale red color, and the pulse is slippery and rapid. The way that I initially treated this patient, and it's similar how I treat other patients of this sort, is that I started with my own research, that is using a point such as stomach 9, which based on my anatomical studies is a target site for the superior laryngeal nerve, which is derived from the vagus nerve. So as you can see from the diagram here, stomach 9 innervates the superior laryngeal nerve, specifically what is called the external branch down here, and then concession vessel 22, which innervates the recurrent laryngeal nerve. Together, the recurrent laryngeal nerve and the superior laryngeal nerve innervates the muscles of the larynx. So that was the corporal local approach based on understanding a neuroanatomy of the acupuncture points. I also incorporated more central approaches using scalp and auricular acupuncture. With the scalp system, I used the jowl style, and I used the lateral 2/5, which correspond to the head and neck. So in case you're not familiar with the theory behind the scalp acupuncture, the image on the bottom here represents the homunculus. As you can see, the medial 1/5 of the homunculus represents the torso and neck and lower extremity. The middle 2/5 represent the upper extremity, and then the lateral 2/5 represent the face as well as the very bottom of the tongue and larynx region. So this is the rationale for why I included the lateral 2/5 in this patient. Then I also used ear points specific to throat point and the vagus nerve point on the lateral surface of the ear, or what's known as the sensory side. And then I also use heart 7, stomach 36, stomach 40. These are points that research have shown has a parasympathetic effect on the body. And as you know, 90% of the parasympathetic nervous system is attributed to the vagus nerve. So it was another component to try to promote the vagal system. Why? Because the laryngeal nerve is part of the vagus, and the vagus is predominantly the way the body regulates the parasympathetic nervous system. So that's my rationale, and this is the result. So here's just a quick look at the points that I use. In red is the throat point, and in green is the portion of the ear in which the auricular branch of the vagus nerve enters the ear, also known as the Arnold's nerve. So this is the part of the ear which the stimulation of the vagus nerve is most optimal. So here are the results. After 3 sessions, using the treatment that I just outlined, he is now able to drink 3 to 4 sips within that 10-second period, whereas previously he could only drink 1 sip. After 5 sessions, he became able to drink 2 cups of juice in succession, which really surprised me. So at this point, the patient is really happy. He is able to not worry as much about choking, and after 7th session, results were still maintained, but because he has found that the condition tends to be worse in wintertime, which is something that makes perfect sense in Chinese medicine, because cold congeals, so closes the GI tract. So he has decided to go to Southeast Asia to escape the cold Canadian winter. Each time, at the end of the treatment, I would send patient home with ASP needles, shown by the applicator and the actual needle itself on the bottom part of the slide. And the points I would always make sure I do would be the throat point in the ear, as well as the vagus point. Sometimes I also will do the Shanmen point in the ear, and the patient has found the result to be very consistent. And however, the results seem to be present only when the ASP needles are in place. Whenever the ASP needles fall out, which they invariably do between 2 days to sometimes after a week, when they fall out, he finds that the results are no longer sustainable. In July 2019, the patient returned to Canada and made an appointment to see me again. So at which point, since I had gotten pretty reasonable results, I repeated the exact same treatment that I had just described earlier. And the patient inquired if there was any other specialists in this area. And at this time, I was already in discussion with Dr. David Alimi to see about whether we can bring him to Canada to teach courses, because I really wanted to study with him. And so I just thought there's nothing to lose. I might as well ask Dr. Alimi if he would be interested in taking this patient, because this patient is willing to travel, and or if his practice is no longer accepting new patients, whether he would be interested in giving me some ideas. So I told him what I had done, and below in the blue text is his suggestion to me. I have to say, Dr. Alimi is so generous. I was surprised. He actually made a little mini PowerPoint presentation for me so that I could understand exactly what is it I'm supposed to do. So the pictures of the ear with the Cartesian coordinate, that's actually Dr. Alimi's contribution to this field. He was among the group of experts that was asked to come up with a way to standardize the coordinate system of the ear so that there could be some level of consistency among different styles of auricular acupuncture. And in any case, so the pictures that you see of the ears with the beautiful longitudinal and latitudinal lines, that coordinate system is the work of Dr. Alimi. And so those images come from him in his little micro PowerPoint teaching presentation to me. So he said to me that I needed to treat the posterior surface, okay, of the vagus, not the anterior surface. So I was treating the lateral surface or the inside of the ear. What I needed to do is I needed to treat the posterior or the medial or the back side of the ear. Why? Because in auricular acupuncture, the lateral surface corresponds to the somatosensory cortex, whereas the posterior or medial surface corresponds to the motor cortex. Now, I have forgotten that even though the laryngeal nerves are from the vagus, and but I have forgotten that that the vagus nerve is primarily sensory, with the exception for the laryngeal nerves, which is motor. So if I want to improve the contractility of the laryngeal muscle, which is innervated by the laryngeal nerves that come from the vagus, I shouldn't be stimulating the sensory side. I got to be stimulating the motor side. So, however, in order to improve the sensation, after all, it is a reflex that requires, the swallowing is a reflex that requires sensory motor integration. Now I needed to stimulate the sensorial part of the throat. And that requires understanding that the cranial nerve that's responsible for providing the mucosal sensory innervation is actually cranial nerve 9, the glossopharyngeal nerve. And then to be more precise, rather than just using the throat point, he recommended that I target a very specific junction between the pharynx and the larynx intersection. Now the rest was completely over the top of my head at the time. I had to do a little bit more reading to understand what the thought process were. But he recommended that I use the epiphysis point, which turns out to be another a more classical term for the word that we're more commonly familiar today, which is pineal, like as in the pineal gland, which is responsible for production of melatonin, but also responsible for our circadian rhythm. And apparently this point, because of its association to the pineal or epiphysis gland, actually regulates all the rhythms of the body, including the peristalsis rhythm as well. He wanted me to include in my treatment stimulation of the frontal lobe, which at the time was completely a puzzle for me. But apparently the frontal lobe manages most of the sphincteric reflexes in the body. So the thought process is that the larynx is a type of orifice or type of sphincter. So by stimulating the frontal lobe, we can actually indirectly influence the sphincter. Lastly, here's where things get a little bit more embryological. Omega-2 point in the ear is said to be the master point of the mesoderm, and which manages vital behaviors such as eating and drinking. So obviously, if you're dealing with the swallowing reflex or atrophy of larynx, we want to be able to promote this type of vital behavior. So he recommended I do omega-2 point. So here is a closer look of what those points look like. Starting with the posterior, or what is called the medial side of the ear, the little blue rectangle here shows you where the vagal nucleus, but specifically the motor side. So it's exactly the same place I put my point, except not on the sensory side, but on the motor side. And that was what's going to be able to help the actual contraction of the larynx. Now, this picture I had to dig up to help educate myself. And it came on totally as a coincidence, because I was in the process of doing some fMRI research acupuncture points on the scalp and was trying to understand more about specific functional areas of the scalp. So when Dr. Alimi mentioned to me that I needed to treat the frontal cortex to help sphincters, I remembered I had this picture in my record because I was trying to learn this. So it's interesting how these things kind of coincide. Exactly as I was learning this, Dr. Alimi has brought this to my attention. But what I want to show you is that if you draw your attention to the frontal lobe area, there is such a thing called a frontal lobe syndrome. And these are a list of conditions that are described. And sure enough, sphincteric incontinence is one of the functions regulated by the frontal lobe. So if you have a frontal lobe syndrome, then you will have among its possible symptomologies is incontinence of the sphincter. So now I understand why Dr. Alimi wanted me to stimulate the frontal lobe, because it was going to be able to activate the frontal lobe control of these vital processes, including the sphincter of the throat. This picture here is a summary of the germ layers and their derivative tissues in the body. Now, I was a little bit confused as to why Dr. Alimi asked me to use the mesoderm point, because even though embryology is something that I took years ago and don't no longer remember, but you bet I'm really looking forward to a very good review from him as I learn his course that's upcoming in 2020. But if I draw your attention to the endoderm development here, you'll see that it includes the epithelium, the GI tract, okay, and it also includes the epithelium of the pharynx. So you would think that to affect the larynx, which is part of the GI tract, you need to stimulate the master point of the endoderm. But why is it that Dr. Alimi says that you got to be stimulating omega-2, which is the master point of the mesoderm? That is because I have forgotten that the smooth muscles that control the larynx belong to the mesoderm layer. It is only the epithelial lining that is controlled by the derived from the endoderm. So this is not unlike the idea that the motor innervation of the larynx comes from the vagus, while the mucosal sensory innervation actually comes from the glossopharyngeal. Understanding that subtlety would make a difference in you understanding which side of the ear you got to treat, or which developmental germ layer or embryological germ layer you need to impact. So here is the beautiful little PowerPoint slide that Dr. Alimi sent me to help me with this patient. On the very top in red here is the location of omega-2, which is the master point of the mesoderm. Here we have the nucleus of the glossopharyngeal cranial nerve 9. Frontal lobe down here will be able to help me control sphincteric reflexes. Epiphysis point, also known as the pineal, regulates the rhythms, specifically the swallowing peristaltic rhythm. And lastly, notice the location of the pharyngeal laryngeal intersection point in green. It is very close to where I have put the throat point, but the throat point is actually 1 point lower than the pharyngeal laryngeal intersection. And it's fascinating that how the slight modification of a slight fine-tuning of this point actually would make a huge difference in combination to this beautiful neurophysiological and embryological rationale behind the selection of these points. So I applied Dr. Alimi's recommendations for one treatment, meaning that he had, when he came back in July 2019, I gave him my original previous treatment, and it was reproducible, good result. Then I had a chance to consult with Dr. Alimi, incorporate his treatment. So now it is the third visit, and he came back and told me that he noticed marked improvement. And I thought he was just going to tell me, well, now I can drink 3 cups of juice instead of 2 cups juice. But instead, I was totally shocked. He said he is now able to eat food easier. So swallowing solids as opposed to liquids, and able to eat food faster, and that this didn't just last the first day, it had lasted 3 days. We repeated the exact same treatment, and I sent him home with ASP needles, this time at the pharyngeal laryngeal intersection, this time at the correct posterior side of the motor nucleus of the vagus nerve. And I would alternate from time to time whether I included the frontal lobe point, or I included the epiphysis point or the omega-2 point. I don't remember the exact details now. I may have done omega-2 on 1 year and the epiphysis on another. And so when he came back after having done this type of treatment twice, he told me that the results was definitely sustainable, that this was not just kind of a fluke one-time improvement. So I wish I could tell you what happened to this patient, but unfortunately the patient has again went back to Asia. Maybe I can expect him to kind of show up in 2020. And but I hope that gives you an idea just how much depth there is to auricular acupuncture when you apply it in a neurophysiological and embryologically informed kind of way. It's not just this is the point and you just do it there. It really requires a proper understanding of the neurophysiology. And so this is the reason why I'm really looking forward to study with Dr. Alimi. I want to use this opportunity to improve my understanding of neurophysiology, which will be broadly applicable to the corporal or body acupuncture that I already do. But understanding the neurophysiology allows me to then take my auricular acupuncture to the next level. For those of you that are interested in joining me to study with Dr. Alimi, here are just some quick bullet point information. The course will be offered as 4 modules, which will alternate between Toronto and Montreal. The first module will be offered February 20th to 22nd in Toronto at the Ontario College of TCM. And then upon successful completion of this course, we will, and also successful passing of the examination and test, which is to be offered at the end of Module 2 and Module 4, registrants are going to be awarded a certificate of competence on auriculotherapy medicale, which is delivered by the International Institute of Medical Scientific Auriculotherapy. This course is taught in French, but it will be translated using simultaneous technology, so that we were not going to be losing time waiting for the translation, because then 4 days of workshop will actually end up to be really just 2 days, because it takes twice as long to translate everything. So it will be video, and also it will be video recorded as well. So in case you're not able to make all 4 workshops, video will be provided for you, so that you can still, so you don't have an excuse to not be able to come to this course anymore. This course is in total of 112 hours, and we're applying for various continuing education units in both Western medicine and Eastern medicine regulatory bodies. Until they are approved, the regulators forbid us from mentioning exactly whom we are applying it for, but rest assured we are covering North America, Canada, different provinces, and the United States, and as well Eastern medicine, Western medicine. The cost of the program is 4,500 Canadian, and there are various ways you can pay for this. You can pay all together. You can pay it as individual modules. You can pay, there's a payment plan in which you pay month to month. The contact information for that is on the bottom of the slide, should you be interested. And lastly, just to summarize the little information case study for today, I just want to mention that Dr. Alimi reason why I want to study with him is because he's really is one of the leaders when it comes to auricular therapy. He has been practicing for 32 years. He is president of Institut International Auricular Therapy Medical Scientifique and a former director of a 2-year auricular therapy program at the Faculty of Medicine of Paris, which is taught to only MDs and dentists. So if you ever think about wanting to study his type of auricular therapy, you can, and you're not a medical doctor, your only chance to do that is actually in the course that we're organizing here in Toronto and Montreal, because otherwise only medical doctors would be accepted if you were to try to go to Paris to do this. And you have to bring your own translator, right? Obviously, that would be very difficult to coordinate logistically. So we're going to provide the translation, the videography, and he is also the author of the textbook Scientific Basis of Medical Auricular Therapy, which is only available in French at this time. But but I'm sure that the workshops is going to be a lot more practical and a lot more pragmatic, because you're going to, from a book, you can understand how to apply the technical aspect of it, which is the strength of an in-person type of workshop. So I thank everybody for the time to listen to this video. I hope you can share my excitement as to why I'm really looking forward to study with Dr. Alimi, not only because my colleagues in Italy and France tell me that I have to because he's awesome, but having personally experienced how my simple approach got results. But the experience of somebody who's been doing this for 30 plus years, plus the rationale about how to do this in a neurophysiological way, makes it really versatile. You can now make your own recipe or your own protocols. And to me, that means you truly, really understand what you're doing. You're not just blindly following certain recipes. Thank you very much.